Yes, yes, Satish, it's visible.
Good afternoon, all. Uh, today we are going to talk about the infection control in EBAI. So, what is infection control? Healthcare-associated infection can be painful and even life-threatening. जो भी healthcare industry में infection होता है, वो काफी painful होता है और life-threatening होता है. इसीलिए हमें infection control or prevention is very important or vital part to care about the patient and healthcare person. Practices and strategies for the maintaining infection control. The major part is the hand hygiene, sterilization and disinfection, biomedical waste management, personal protective equipments, vaccination, and the always important education and training.
Yes. There are numerous studies which tell about the missed areas if hand hygiene is done inappropriately. And certainly there are various areas which we touch every day, and hence it can transmit the microorganism to the people and environment. WHO has described 5 key moments of hand hygiene. So let's discuss one by one. First key moment is before touching the patient. Second key moment, after touching the patient. Third, before doing any aseptic procedure. Fourth, after blood and body fluid exposure. And fifth, after touching the patient's environment.
5 moments of the hand hygiene. It is the same applicable in the EBAI. It is same applicable in the EBAI. So, before touching the patient, whenever you go for the call or we are doing any surgical laboratory procedure, we have to clean
अरे
out.
बोले वहां तो मेरी भी बेचारे बच्ची पढ़ती है, बोले अनुश्री दीक्षित करके है, बोले नाम उसका, बोले मेरी बेटी की फ्रेंड है, बोले वो भी वही है, पारुल में ही है, मैं यहाँ से ही पढ़ा हूँ, बोले उसी माइंड में.
Mr. Shripad, can you mute yourself?
कहने बोले बोले अनुश्री दीक्षित को तो मैं जानती हूँ, बोले उनके तो अच्छे टर्म्स, हमारे फैमिली टर्म्स अच्छे हैं, बोले.
हेलो श्रीपद जी, आप म्यूट कर सकते हैं.
Yes, sir.
Moments, it is the same applicable in the EBAI also. Before any surgical procedure or any donation call, we have to wash your hand. After the same procedure, whenever you are doing any procedure in iBanking, so we have to maintain the hand hygiene. Before the hand hygiene, what is the preparation? First, to remove hand and wrist jewelries, watch, keep your nails short, avoid nail polishes and artificial nail. There are 3 types of hand hygiene: social hand hygiene, medical or procedural hand hygiene, and surgical scrub. We both 3 are using in the iBanking and day-to-day practice. Mostly for medical hand hygiene, we have to use the 7 steps hand hygiene, and for surgical, for 9 steps. By using soap and water or by using hand rub. The most of at the field, whenever we go for the donation call, at a home call or any other areas, we don't have available of the soap or water. So in that case, we have to use the hand rub. Here is the duration of the hand rub. 20 to 30 seconds for hand rub, 40 seconds to 1 minute for the medical hand wash, and 2 to 5 minutes for the surgical hand wash. You can see the 6 steps of the hand hygiene. First step is to rub palm to palm. Second is rub the back of the both hands. Third is the rub palm to palm, interlacing the fingers. And fourth one is the rub the back of the fingers by interlocking the hands. Rub the thumbs and rub palms with the fingertip. ये स्टेप्स है, ये ऑल बहुत इंपॉर्टेंट है, क्योंकि आप अपना हैंड हाइजीन मेंटेन करोगे तो ये आप क्वालिटी या फिर सेफ्टी प्रिकॉशन से कोई भी कॉल कर सकते हो, आप आपको बचा सकते हैं किसी भी माइक्रोबायल इन्फेक्शन। ये हैंड स्क्रब टेक्निक मोस्टली वी आर यूजिंग इन सर्जिकल प्रोसीजर और at the donor side for the eye donation call. So first, either you take a 5 ml alcohol-based hand rub with the help of assistant, or if you have the dispenser at the
लिंक भेज सकते ज्वाइन करने का। मीटिंग चल रही है ये, देखो भैया हमारे काम का डन किया, भूल जाओ तुम लोग, तुमने ज्वाइन की
5 ml of
ज्वाइन करो यार तुम लोग, तुम्हारे काम की चीजें तुम ज्वाइन नहीं कर रहे।
In your left hand, and put your fingertips in the solution for 5 seconds, and then overlap all the remaining hand rub solution from your back side of the hand palm to elbow. Repeat the same procedure with the other hand. And again, earlier explained the hand wash movement. Use the same 6 technique, that palm to palm, back of the palm, interlacing, interlocking, thumb, and fingertips. What is the sterilization and disinfection? There are difference between the disinfection and sterilization. Disinfection is the procedure of the elimination of the pathogenic microorganism. However, the procedure is not effective in case of the vegetative spores. ये disinfection ये procedure है कि इसमें हम clean कर सकते हैं, या फिर हम कुछ microorganism और pathogenic ये है वो क्लीन करते हैं या फिर डिसइंफेक्ट करते हैं, बट कुछ भी वेजिटेटिव स्पोर्स है तो वो डिसइंफेक्शन से नहीं जाते, तो उसके लिए हमें स्टरलाइजेशन करना पड़ता है। स्टरलाइजेशन refers to any procedure that eliminates or remove, kills, or deactivates all forms of the life and other biological agent present in the specified region. Sterilization procedure में हम जो भी पैथोजन स्पोर्स है, ऑर्गेनिजम्स है, वो किल करते हैं। तो in to the sterilization procedure, which all living microorganism including viable spores are either destroyed or removed from any article, body surface or medium. Disinfection मैंने बताया कि process that destroy the remove or most if not all pathogenic organism but not bacterial spores. Disinfection have a 3 levels: high level disinfection, intermediate level or low level. Cleaning yeah, removal of the foreign material from an object. It's a very important part. Disinfection reduce the number of pathogenic microorganisms but not spore from any object to level which is not harmful to the health. And sterilization, again, the object is free from all the microorganisms and their spores. But most important thing is you can clean without sterilization. अगर आपने sterilization नहीं किया फिर भी clean कर सकते, but you never clean, never can sterilize without cleaning. So which is the sterilizable instrument we are going to use for the eye donation call? Firstly, you have to clean all the instrument, and then you have to pack and send for the sterilization. The 3 levels of the disinfection. The high level disinfectant kills all the microorganisms except high number of the bacterial spores. In this disinfection, we use the aldehyde, hydrogen peroxide, or acetic acid. Uh, in uh, in low-level disinfectant, kill resistant mycobacterial, vegetative bacteria, fungi, and most virus, but not spores. For that, we use betadine, chlorine components such as sodium hypochlorite or alcohols. In LDL, LLD, low-level disinfectant kill most vegetative bacteria, some of virus or some of fungi, not every or spores. Sterilization. There are various methods of sterilization. Mostly common or used method is steam sterilization. It's called the autoclave and ETO. Or plasma sterilization, liquid chemical, peracetic acid, ionizing radiation, or dry. In iBanking, we mostly use ETO, autoclave, and dry sterilization. The layout of the CSSD, most of the iBank have their own autoclave, but which is the iBank is connected to the eye hospital or multi-specialty hospital. They have their own CSSD section. For that, we have to there should be minimum 6 basic division in the CSSD. That the cleaning area, so separate area, drying area, packaging area, sterilization area, and all the and storage for the all sterilized item and issue counter. Cleaning and decontamination. For the cleaning, wear appropriate personal protective equipment. It's very important because you are handling with handling the dirty instrument which can be harm to you. So in infection control, the PPE is very important. So mostly for cleaning, use the gown, goggles, boots, mask, head cap, and gloves. There are two types of cleaning. One is manual cleaning, or other is the mechanized cleaning. Manual cleaning, there are again two parts: primary cleaning and secondary cleaning. And machine cleaning is tertiary cleaning. Most of the iBank don't have that facility. Most of the iBank have that facility, but it's not necessary to you have to clean the mechanized. You can use manual cleaning appropriately or properly. Cleaning, initially, whenever you segregate all the instrument, it should be soaked in the medical enzyme detergent for 15 minutes. After that, you wash and wash all the instrument under the running hot tap water, or you can use the ultrasonic cleaner. It's a machine cleaning, and then allow all the instrument to dry on a fresh washed cloth. You can use dryer or blower also, but drying is important. If you pack all the wet instrument, it can be rusted. Then double wrap your tray for the sterilization, and label the double wrap instrument pack. Mostly use the name of the pack. What are the packed inside that instrument is important. Date of the pack, because most of the IBAN use the 3 days autoclave instrument or 7 days. So you have to mention the packing date. And said, linen said, or signature of the CSLD technician who have packed or who is going to autoclave. So उनका signature वहाँ पे important है. Again, put the chemical indicator which shows it is sterilized or not. For the instrument cleaning, we have to soak all the used instrument in medical enzyme detergent for 15 minutes. Then properly dress technician, scrub with the soft bristle brush, wash under running hot tap water, and wash in ultrasonic cleaner. Allow all the instrument to dry on a fresh washed cloth. Alternatively, you can use the blower or dryer. But drying procedure is very important. If you are not going to dry any instrument and you send it to the sterilization, then your instrument may be rusted. Then double wrap the instrument and send for the CSSD. Before it, label all the pack correctly. Put a name of the pack, what date and particulars of the pack, and signature of the CSSD technician, and put a chemical indicator inside and outside the pack because it shows it is sterilized or not. The most important part of the infection control is biomedical waste disposable. What is the biomedical waste? Any waste which is generated during any procedure, diagnosis, treatment, or immunization, or human being or animal, or in the research activity, or in the EBAI. So, how can we segregate the waste? There are different color coding for the segregation. General waste, just like such like a kitchen waste, paper, tissues, water bottle, are discarded in green or black dustbins. Infected plastics, such as a used syringe, gloves, plastic waste, are discarded in red bag or red dustbin. Infected waste, any solid, anatomical, chemical, liquid, laboratory waste, in eye bank, rejected eyeball or used eyeballs, used cornea, can be discarded in the yellow dustbin or yellow bag. Glasswares is discarded in blue container or blue dustbin. Any sharps, just like surgical blade, syringes, needle, sorry, not syringes, needles, are discarded or in puncture-proof white container. Handling of the biohazardous waste. Needle and blades should be discarded after flashing the sharps end in the puncture-proof container through a hole in the lid of the container. Puncture-proof container must be changed before reaching the filling line. Never break contaminated needles, or do not bend recap disposable needles. Recapping needle, it may harm to the person who is recapping it. Infectious waste, sharp disposable. You can see the containers. You can use white or such containers, which is a hard or plastic containers, and a single hole at the top of the at the top. You can put all sharps and needles in the container. Again, yellow bag, you can pack or discarded eyeballs, CS3, used cotton swab, gauze pad, or cotton bud can discard in the yellow bag. Red bag, gloves, disposable syringes, swab, saline bottles, all plastic items and syringes. Green or black bag, paper or stationery. Location of the central biomedical waste store may be in the basement or in the separate area. Again, practices should be do not allow to full all the dustbins. The dustbin should not be filled completely. It must fill till the 3/4. Whenever it fill till 3/4, please replace it. Biomedical waste can be stored in
ಅದೆಲ್ಲ ಅವಾಗಿನ ಆಗೈತಿ ಅಲ್ವಾ ಏನ್ ಕೊಡ್ಬೇಕು ಹೇಳಿ ಕೊಡ್ತೇನೆ ಹೇಳಿ
biomedical waste can be stored in the department for 48 hours. The final disposable is outsourced to the authorized appointed by the local municipal health corporation, that is PASCO or such agency. You can send the all disposable to that agency. Points to be remembered: who is segregating the biomedical waste? That staff should be familiar with proper use of PPE. Ensure availability of hand washing facility and be familiar with hazards that might occur during the biomedical waste management, and segregate BMW appropriately. And the main factor of the infection control is personal protective equipment. All healthcare personnel should wear the specialized clothing or personal protective equipment to protect themselves from exposure to the blood or body fluid spills. What is the PPE? PPE, mainly there are different parameters or the factors in the PPE. Boot, gown, surgical procedure mask, goggle or face shield, gloves are the PPE. And sequence of the donning the PPE. First of all, you have to wear boots, then gown, then surgical procedure mask, then goggle or face shield, and lastly gloves. There are two types of gloves. You can examination gloves and surgical gloves.
এখন না এখন বাইরে গিয়ে দাঁড়া
There are many types.
হাতে দেবো মেয়েকে সই করতে হবে একটা একটা করে ছাড়তে আপনারা একটু বাইরে গিয়ে দাঁড়া
Recommended practices. Cap is the optional, but for the IBAN call or any surgical procedure, you have to use the cap. And surgical mask should use while using any aseptic procedure. While risk of the exposure to your saliva and respiratory segregation to the others, while taking care of droplet airborne infection and the patient, airborne infection patients. N95 mask must be worn by anyone entering the patient's room, that is on airborne precautions. In pandemic, most of us, I don't see most of this, everyone should have to use the N95 mask. Eye shield or eye protection, it's optional. Expect in the special circumstances such as when community transmitted is a moderate or substantial eye face protection must be worn during the activities. Gloves recommended in circumstances such as the contact of high risk of the contact with the blood, body fluids, the contact with the mucous membrane, contact with damaged skin. Health professional administrating the vaccine as skin lesion while doing any aseptic or sterile procedure. If using gloves, always change them between the patient. Heavy duty gloves should be considering when handling any sharp or biomedical waste. Surgical gown should to be worn by healthcare personnel during the surgical procedure. In our cases, surgical gown should be wear in every procedure, in laboratory procedure and at the IBAN call. Challenges in implementing effective hospital infection control, the resistance to change. Because we are using a lot of practices since long year. So there may be many hesitations to change practices, lack of resources, high patient turnover, or limited communication and collaboration, and inadequate training. Thank you. Any questions?
Thank you so much, Satish. If anyone have questions, they can directly ask or they can put in the chat as well.
I just want to congratulate to Mr. Satish for this wonderful presentation. Thank you, Mr. Satish. Thank you.
Thank you, sir.
Thank you, Satish.
Hello.
Hello.
Hello. Good evening.
Yes, Robin. Yes, Robin.
Yeah, we have a doubts. When a patient we recover the cornea after removal of the blood, then the HIV or HBCG will positive. How can I discard the tissue?
Tissue should be discarded in yellow bag, and medium should be discarded along with the sodium hypochlorite, just like a blood discardation.
Oh, okay, sure.
Tissue, you have to discard tissue in yellow bag, yellow container, and the medium should be drained in the sink along with the sodium hypochlorite.
Okay, sure. Thank you, thank you, Satish.
Thank you, Robin.
Any other doubts? Okay, if there are no questions, then I think Satish, give that compliment that everyone understood the topic very well. But in case people have questions, please directly put them on the EBAI webinar group. Satish, you are part of the group, if I'm not wrong.
Yes,
EBAI webinar group. So Satish, please feel free to answer the questions there if anyone have questions. And again, we will be circulating the abstract guidelines for the conference very soon. So if anyone wants to submit the abstract, please feel free to do so. Go to www.ebai.org to get more information about the conference, and please make utilization of the early bird registration, which is before 31st of July. So thank you so much. Looking forward to meet you in the next webinar, which will be on Wednesday now, on documentation, again at the same time, 3 p.m. Next Wednesday. So thank you so much.
Thank you.
Thank you, Satish.
Thank you, Satish. Thank you, Ganesh.
Thanks, Satish, for the wonderful talk.
Okay, ma'am. Thank you.
Thank you, Satish.
Thank you all of you.
Thank you, Ganesh.
Okay, bye-bye. Thank you so much.
Bye.
Thank you.
Bye.
Bye-bye.
Thank you.
Thank you, madam.
Thank you.
मैडम ये जो कॉन्फ्रेंस होनी है वो हमारे जो हमने सर्टिफिकेट जैसे हमने लेना, हमने तो आई वाला कर रहे हैं ना, क्योंकि हम तो आई डोनेशन से लेके गए हैं।